Los Angeles County saw an average of 40 coronavirus deaths a day over the past week, the highest such rate in nearly 10 months, a sign that the prolific Omicron variant may be deadlier than many initially believed. The county's daily COVID-19 death rate has doubled in just a week, officials said. According to a Times analysis, the last time average daily deaths has been this high was for the 7-day period that ended on March 28, 2021. The daily death tally in the county has climbed dramatically in recent days. On Tuesday, 15 deaths were reported, Wednesday, 39, Thursday, 45, Friday, 48, Saturday, 66, the highest number in more than 9 months, and Sunday, 53. As deaths often lag behind surges in cases and hospitalizations, sadly, the increase in deaths does not come as a surprise, and tragically, we are. County Public Health Director Barbara Ferrer. The latest average daily death figure remains well below that of the peak of last winter, when very few people were vaccinated because of limited supply. At that time, L County was averaging about 240 COVID-19 deaths a day. Much has been said about Omicron being less likely to cause severe illness and death than earlier variants. Around New Year's Eve, headlines emerged about South Africa heading out of its Omicron surge with relatively few deaths. Experts have pointed out that Omicron in adults is less likely to infect the lungs, which can result in difficulty breathing, while being more contagious in the upper respiratory system. There are also fewer critically ill COVID-19 patients in the county compared to last winter. The number of coronavirus patients in the intensive care unit is just 36% of the peak of last winter's surge, when there were 731. But some experts warn that the U.S., with a demographically older population, could experience a deadlier Omicron wave than South Africa, and in L County, data are emerging that this winter's surge is resulting in more critically ill patients than seen during last summer's wave. Just in the last week, L County's number of ICU patients with COVID-19 soared past the peak of the earlier Delta surge.